Cervical cancer is an uncommon type of cancer that affects the cells in the neck of a woman's uterus. It occurs when abnormal cells form in this area, which leads to uncontrolled cell growth and development of new blood vessels. The symptoms of cervical cancer are often nonspecific and include abnormal vaginal bleeding, lower abdominal or pelvic pain, a history of sexually transmitted infections such as chlamydia or gonorrhea, unexplained weight loss, fatigue or weakness associated with menopause, among others. If you have been experiencing any one or more symptoms listed above, but cannot identify their root cause to your satisfaction, then you should consult with your doctor without delay. Cervical cancer can be caused by the following. But before knowing more about how to fight cervical cancer and the symptoms, hit the subscribe button if you like this video to never miss our new plan to help you boost your metabolism. Cervical ectropion. This happens when the outer layer of the cervix, the ectocervix, pulls back from the vagina during childbirth or a normal menstrual cycle. The problem is often resolved after giving birth or by returning to normal menstrual cycles. Anatomical changes. When the cells in your cervix are changing, a new cell layer may be formed just underneath your cervical mucous membrane that may result in an abnormal enlargement or distortion of your cervix. If you notice this change, do not ignore them and see your doctor immediately for further diagnosis and treatment. Genetic abnormalities. Cervical cancer can be inherited from a parent if one of the parents or siblings has had the disease. Viruses or human papillomavirus, HPV. These are caused by an infection and they are transmitted through sexual contact. These viruses can also cause cervical intraepithelial neoplasia, a precursor to cervical cancer. If you have ever been exposed to HPV, your doctor will perform a Pap test to check for abnormal cells of this type. Inflammation. If you have inflammation in your cervix due to infection, then you may also experience an increased risk of developing cervical cancer. Risk factors for cervical cancer include history of sexual contact or genital warts. These two factors increase the chances of developing cervical cancer because of repeated exposure to HPV, the virus that causes genital warts. Genital warts are caused by HPV also, and they are transmitted through sexual contact, especially during vaginal sex. If you have had multiple partners in your lifetime and have been exposed to HPV in either genital area, then your risk of developing cervical cancer goes up. The risk is also increased if you have had a series of Pap smears over time and have found normal results on each test. This means that you have been exposed to HPV but not yet developed cervical cancer. Obesity. This is a major risk factor because of the relationship between obesity and chronic inflammation, which results from the body's inability to adequately respond to chronic infections. Obese women are also at high risk for developing endometrial cancer, another type of uterine cancer. Infections. An infection of chlamydia or gonorrhea can result in the development of cervical carcinoma because of the harms they cause to your immune system. Women who have a weakened immune system are at a higher risk for developing cervical cancer because their bodies cannot fight off infections that may cause serious damage to their reproductive organs. Excessive alcohol use. A study from Sweden found that drinking 7 or more alcoholic beverages per week increased the risk for this disease by a factor of 25. The same study indicated that consuming 5 or more drinks per day increased the chance even further. If you drink, it is important to limit your intake. How can you prevent the symptoms? 1. Being aware of your risk factors. Know the symptoms of cervical cancer. 2. Having regular Pap tests. A Pap test is a simplified form of a colposcopy, which is an invasive procedure in which a doctor looks into the vagina with a special tool called a colposcope. If you have had abnormal cells found during your last Pap test, it may be necessary to undergo a colposcopic exam before proceeding with any kind of therapy, such as surgery or radiation. If abnormal tissue can be identified, There is less risk for developing cervical cancer because the abnormal cells can be surgically removed without further damage to surrounding tissues. 3. Frequent sexual health checks. It is important to get a regular exam every year with an experienced physician. This will help you keep track of the changes in your reproductive organs and can indicate if any lesions are developing or if something else is causing unusual symptoms. 4. Don't smoke. Smoking increases the risk for cervical cancer due to exposure to carcinogens and other toxins that damage the immune system, which may increase the risk for developing cervical cancer. 5. Screening for hepatitis and HIV. These two viruses both weaken the immune system, so they increase the risk for developing cervical cancer. Ask your physician to perform a test with your pap smears if you are at a higher risk of infection due to sexual activity or living conditions. 6. Diabetes. If you have diabetes and have been exposed to HPV, it is important to monitor your blood sugar levels closely so that you do not develop an infection that may lead to an increased risk for developing cervical cancer. Menstrual cycles accompanied by high blood sugar levels may be another warning of an impending infection. Taking insulin can improve your blood sugar control and reduce this risk if you are diagnosed with diabetes. 7. Get informed. There is a lot of misinformation out there about cervical cancer, so it is very important to get accurate information from your family doctor or a properly trained healthcare provider who treats both women and men with gynecologic problems, including cancer, regularly. Oncologists are physicians who specialize in the treatment of cancers of all types, including gynecologic cancers. Make sure your doctor has experience treating cancer patients and that he or she has gone through a course on cervical cancer in order to treat patients correctly. A good diet plan can also help you. Try to eat the recommended amount of fruits and vegetables. It is recommended that women should eat 5 servings per day and men should eat 6. Opt for whole grains, which help eliminate inflammation in the body. Certain foods can also reduce inflammation. Try to avoid eating high-fat and high-carbohydrate foods as much as possible, as these are all inflammatory substances. Choose fresh meats, poultry, fish, and eggs, rather than processed meats or dairy products that contain hormones or pesticides. Vitamin D plays an important role in the protection against HPV. You can get it from sunlight, eggs, cheese, and fatty fish like salmon. Eat foods that have a high amount of calcium in them to improve bone density. Boost your intake of omega-3 fatty acids found in fish oils and flax seeds to improve immune function and reduce inflammation. Vitamin E is also an antioxidant and was found to have anti-inflammatory effects in many studies. Make sure that you get enough vitamin A and C, both of which are antioxidants. Vitamin C has anti-inflammatory properties. To keep the immune system healthy, try to eat a lot of fruits, vegetables, seeds, and nuts. Vitamin C, omega-3s, vitamin E, and selenium are all good for your immune system. We hope you enjoyed this video and learned new things about the cervical cancer cells. If you have any questions, feel free to leave a comment below. Also, don't forget to let us know if this worked for you and how it affected your body. Thanks for watching this video, and if you want more videos on how to boost your metabolism and lose more weight, make sure you subscribe so you don't miss out on future videos.